Newsfeed Now. Coronavirus facts, not fear, begins now.
And a good Wednesday to you. Thanks for joining us for Newsfeed Now. I am Aaron Nolan. March has finally ended. It was a very long 31 days, but April could be longer. The reason I say that, the White House is telling us to brace for the peak of coronavirus sometime over the next few weeks. Coming up in a few minutes, we are live in Nashville as a recording artist and a popular social media blogger who actually has COVID-19 tells us what it's like living with the coronavirus. But first, let's break down the facts and figures on this April the 1st. This is our national tracker. 189,000 U.S. cases, 4,000 deaths. In New York alone, close to 76,000 cases. As we take a look around the country, California, 8,500. Louisiana, another epicenter with New Orleans, 5,200. Washington State, where a lot of things started, 5,400. Looks like Delaware right now with just shy of 19,000 cases. So again, interesting stuff coming out as the coronavirus cases continues to spike nationwide. Let's take a look at what's happening with Uber. Uber is now offering 10 million free rides to healthcare workers and seniors during this coronavirus. The company is working directly with cities, food banks, and hospitals to get people what they need. There's been a lot of discussions about wearing a mask. The U.S. Surgeon General has confirmed during an appearance on Good Morning America that happened today, the U.S. Centers for Disease Control and Prevention is taking another look at whether healthy people should wear masks to help prevent the spread of COVID-19. Last month, Adams urged Americans to stop buying masks, but health officials have learned more about the virus, which could prompt them to change recommendations. As the White House and the CDC discuss this issue, the World Health Organization recommends that only people who are sick or taking care of someone who's sick should wear a mask. The Trump administration is warning the U.S. that April will be a rough month when we're talking about COVID-19. There were 830 deaths from COVID-19 on Tuesday in the United States. The thought in the Trump administration is the pandemic's threat, well, it's yet to peak.
It's going to be a rough 2-week period. As a nation, we face a difficult few weeks as we approach that really important day when we're going to see things get better.
Get things better. That's something that we all want to see. Let's go live now to Washington, D.C. Jesse Tenner joins us. And Jesse, I've said this a couple of times so far this month as we have wrapped up now March. That was the longest 3 years of my life. And now we're looking at April being what may be even longer as we're waiting for the peak to happen. What are lawmakers saying is going to happen, and what can they do right now in order to protect Americans?
Yeah, so lawmakers are really kind of practicing what they've been preaching. They're all, for the most part, home in their districts right now, also pretty much quarantining and practicing social distancing. So they're still trying to get used to working from home. We are hearing that since it does look like that, really May could be the point that maybe some of the country starts opening up again, since the White House last night did give that April 30th guideline now. They're actually looking into doing, telecommittee hearings, things of that nature, to still get the process in Washington moving along, even though not everybody is huddled here.
As we move forward, obviously Washington is being briefed first when it comes to the latest facts and figures. Dr. Fossey, we just saw him on our screen there. What are we hearing about that peak date? Are we talking about a peak date of when that's the highest of the high, we're not going to go any higher, we can start to decline and maybe normalcy will come again? Or is that maybe the peak concern and things could still get worse? I think there's a lot of weirdness there in that. What is Dr. Fossey and the Trump administration saying as far as the definition of peak?
I think right now they're still trying to walk that fine line of telling Americans exactly which date we could peak and then hopefully start seeing some relief. President Trump said yesterday during the briefing that Americans should brace for a pretty difficult 2 weeks ahead. So some think that, the peak could be then. Dr. Fauci, you mentioned, has been very careful to kind of throw out a date. But since he's been working very closely with the White House, and the White House now extended really kind of its national shutdown stay-in guidelines to April 30th, they may be thinking that it may not peak until later in the month as well.
All right, Jesse, thanks so much. Appreciate you taking the time here out of Newsfeed Now. We were just talking about it. Every day we get new numbers. Those numbers rise constantly. Those numbers are tough to take, but those numbers don't have faces. Today, for the first time here on Newsfeed Now, we're going to chat with one of those numbers. It's a popular social media blogger who is now facing challenges in isolation with COVID-19. Before you meet Liz Mace, let's get her full story with our Brent Ramonda.
Life before the coronavirus pandemic was much different for all of us. Liz Mace spent time performing and spending time with her fans. But now things are different, and she's seen what the virus can do firsthand, being one of the many people who have now tested positive for COVID-19.
It was the chills, the low-grade fever, and when I woke up the next morning to go get tested, I had a horrible headache.
Today marks 2 weeks in quarantine, and she's doing much better. But that's not always the case when someone contracts the virus.
You do not know how it's going to affect you personally. My personal case, it was very easy, very light. But I know of other people who I've read about who are my age who have a horrible reaction.
The elderly population has been hit hard by the virus. One of Liz's first thoughts after testing positive was how her mom was doing.
But when I first got the results back, I started crying because, my mother is elderly and I had just seen her think, she's fine.
Liz doesn't know where or how she contracted COVID-19, but now she's sharing her story to encourage others to follow the guidelines to stop the spread.
You don't know if you're carrying it, and you don't know how your friend is going to react or how you're going to react.
Brent Ramonda, News 2.
Brent, thanks so much. Interesting story there from Liz. She now joins us live from Nashville. Liz, first thing, we'll ask a lot of interesting questions. We appreciate you joining us here. When you first got the news that you, in fact, had the coronavirus, what was your response?
My response to finding out that I had coronavirus was I started crying. I know that's kind of like a silly response, but this is what everybody's talking about, and I was the first person that I knew to even get tested, let alone have the virus, and I was very emotional. I was worried about who I had infected. I was worried about my own health. I was worried about my husband's health, and it was very emotional.
I don't doubt that, and I don't think it is a silly response, Liz. I think that's pretty spot on. I mean, it's a terrifying proposition to have what has essentially shut down our globe, our world.
Yeah.
What are the symptoms? I mean, how do you feel, and is this as bad as what we've all been hearing?
So I'm actually officially 2 weeks out from showing symptoms today. And currently I feel just fine. And I actually recovered from the symptoms within like 3 days. But when I first got sick and started showing symptoms, I got the chills really bad. I had a horrible headache, and I had like a low-grade fever and just like body aches, really bad body aches. It felt like I had like run a marathon the day before. But other than that, I had no respiratory symptoms. I had no shortness of breath, no cough, no chest tightness, nothing like that. So that's why it was such a shock to me that, the test came back positive because, at the time, even 2 weeks ago, I felt like no one who was experiencing symptoms that didn't have the respiratory symptoms. So it was definitely a shock, but I am happy to report that in my case, it was extremely mild, and I felt pretty much recovered within a week. So
that is good news. I'm interested from you. Isolation, social distancing is so important, and people have been talking about it so much. For someone who is now going through this, we sure hope, Liz, you're on the back side of this virus. What is your stance right now on social distancing and the isolation that has become a vital part of stopping the spread of COVID-19?
Well, my husband will tell you that I am the most passionate about it. It is so important because, like I said, I was the only person that I knew of that had the virus. And that was scary because I was being cautious, and I was social distancing, but I had no idea that I was carrying the virus. and there was no indication that I would have been carrying it. I wasn't exposed to anybody that I knew of. So that's why it's so important to stay home and social distance and not have, parties and whatever. It's like you genuinely have no idea if you're carrying it. And you have no idea who you're infecting and how that person is going to be affected. And so that's why it's such a big, crucial time to just stay home. Because if you do get sick, then you're going to be home and you're not going to be spreading it to anybody else. And that is just the most important thing right now.
Speaking of being at home, how's your husband?
So believe it or not, he is not showing symptoms.
Great.
He has not shown symptoms, in the past 2 weeks. So with isolation, we have direct instruction from the CDC health department that once my isolation ended, his started for 14 days. So he actually is not allowed to leave the house for really any reason for until next Tuesday, just in case he does start showing symptoms. Yeah. So, yeah.
How did you pass the time? I'm interested in that one because this is not the same social distancing and isolation that me and my kiddos have. I mean, you're locked down. You're closed off from the world.
Yeah. Well, for the first, 5 days, I felt really sick, so it wasn't that hard. Because the CDC actually changed its instructions from 14 days to 7. Yeah. Which is something that a lot of people were actually surprised to hear. So really, it was only 7 days that I really had to be completely isolated, and then after that, I could go for a walk in the neighborhood. But I've been reading some books. I've been watching some TV shows. I feel like, like most of America, spending a lot of time online.
Have you written any music?
I haven't.
I think you should write a song about living with COVID or the coronavirus or, something like that.
Yeah, that's a great idea. I mean, I've got, we've all got 30 days, we've got the whole month of April, so I'm going to have a whole album by the end of it.
I think so. Liz, thank you so much. We're really happy you joined us. Thank you for spending some time. Best wishes to you. Good follow on Instagram. It is, what's your handle? Stella218, right?
Yes, it is.
All right.
Yeah. Thank you so much.
All right, Liz. Get to feeling better. Stay safe. Stay isolated, first and foremost.
Yes.
All right. Thank you, Liz.
Everybody stay home.
So social distancing is helping. Isolation is not only isolating us, but it could isolate the virus and stop the spread. We know this, but we still need to be proactive as a country. So what's next when this COVID-19 stops? How can we better prepare ourselves for the next strain or for our future or for tomorrow? Well, in Chicago, doctors might have a new treatment. It's a drug developed for Ebola. Yeah, that virus. And now there are patients ready to give it a go. Let's go to Dina Baer.
Inside the medical intensive care unit at Northwestern Memorial Hospital, an IV drip, a drug, and a step toward a treatment for COVID-19.
It's a watershed moment.
And one patients and their families around the world have been hoping for since the start of the global pandemic. Here in Chicago, an 89-year-old patient led the way toward a possible new treatment when earlier this week, he was among the first to take part in a clinical trial to test remdesivir, an antiviral medication that was initially developed for Ebola patients and is known to be active against other forms of coronavirus, including SARS-CoV-2, the virus that causes COVID-19.
It's a really special drug from that perspective, and one that hopefully will live up to its promise.
The drug trial was given the green light by the National Institute of Allergy and Infectious Diseases. Patients will receive an infusion of remdesivir or placebo in the randomized double-blind study.
Each participant, of course, has a 50-50 chance of getting either the active drug or placebo, and that continues every day for up to 10 days.
Northwestern has already enrolled 8 patients. For many, it was family members who agreed on behalf of their loved ones, 2 critically ill and on ventilators.
All the families of our volunteers and the volunteers themselves, they really are the true heroes of this effort because they are volunteering for something without any promise of direct benefit.
Researchers believe remdesivir stops the virus from reproducing in the body, lessening the severity of illness.
The first question being asked is this safe to administer to patients with COVID-19? The next question is it effective for the treatment of COVID-19? Our hope is that this trial will be able to address both and give us answers that we desperately need for our patients.
Dina is a medical reporter in the Windy City. This is big stuff as she joins us now live. The doctor said it was a watershed moment. Does this provide hope for us? And how soon could we be rolling this out to the masses if it is hope?
So here's the thing, remdesivir is already available. It is an antiviral, and as you mentioned, it was used to try to treat Ebola. Not very successfully, I might add, but it does work against coronaviruses, which of course COVID-19 is caused by a coronavirus, and Ebola was as well. The reason it's exciting is because when we look at the numbers here, there are far more flu cases than there are COVID-19 cases, but there is a medication for the flu. There is a vaccine for the flu. So scientists are working very rapidly right now to find something that helps people to reduce the severity and the longevity of their symptoms. Remdesivir is one of them. Hydroxychloroquine combined with an antibiotic, azithromycin, which most people know as a Z-Pak, is another medication combination that's being tested in New York as well. That seems to have some great success so far, not only in trials, also in China, but anecdotally, we've heard of patients who were not doing well and did well on that medication. The whole idea is to find something that can help our bodies recover from the onslaught that this virus presents. And there's one other thing that I think is also pretty exciting, and that is this idea of convalescent plasma. And that is when someone had COVID-19, gets better, they take their blood, and their blood now has antibodies that could help someone else recover from it.
That is fascinating in that as we self-isolate for others, also those who have recovered from it could actually help others as well. Where are we on that? And my second question with remdesivir, what's the time frame for what this trial could look like before it may be acceptable for others to use?
Worldwide, they're hoping to get 400 patients to be in this, but as you heard in my story, it's a double-blind study, which means the doctors don't know who is getting it, but more importantly, some patients, half of those patients, are going to be getting a placebo and not getting remdesivir. Again, it will be sped up because the drug is already widely available to prescribe, so it's something where if they find that it does no harm to the patients and it actually works against COVID-19, it could be in the pipeline almost immediately.
Wow, that is pretty impressive stuff there. I also know that I read recently that Chicago, the cases are spiking, and that's going to be another area where a lot of people are focusing on COVID-19 is the Chicago area. What can you tell us about what's being done there to maybe curb some of that spread and how things are going there in the Windy City?
Well, in Illinois, we had a record number of cases yesterday, 900 new cases, and really they are concentrated in Chicago, in the Cook County area. Our mayor and our governor have been on the forefront of having people stay home, this social isolation. Businesses are shut down except for essential businesses, and we were among the first to do that, but we knew that it happened too late because the cases were already spreading. We also knew that we didn't have access to testing very early on, so we have been testing at a much more rapid rate. So when you look at the numbers and you see the giant spikes, it's because we're testing more people now. And so we're just beginning to see people who are recovering from this as well, but we've got a long way to go, and we just extended our stay-at-home orders until April 30th.
Wow, another 30 plus days. All right, Dina, thanks so much. Interesting stuff. Appreciate you taking the time here on Newsfeed Now. If you've got a question regarding COVID-19, we're going to be sitting down with doctors this weekend to get some key questions answered. You can email us coronaquestions@nexstar.tv. Another automaker using one of its factories to make ventilators. Ford is hoping to manufacture 50,000 in 100 days at a Michigan plant. The automaker will produce a type of ventilator that only uses air pressure and requires no electricity. Southwest Airlines reducing its schedule by 40% starting in May. This due to the outbreak. That's about 1,500 less flights a day. Every Sunday around America, folks are usually flocking to church. But during the outbreak, many congregations have moved to online. Pastors leading Sunday service from maybe their living room. But in a few places, pastors have decided to go on with church, inviting hundreds, if not thousands, to join them at a location. It's happened in Florida. We're talking about Louisiana, though, right now, as a pastor is in hot water and facing charges. Abby Rocha has the story.
Mr. Spell made his intentions to continue to violate the governor's order clear, Instead of showing the strength and resilience of our community during this difficult time, Mr. Spell has chosen to embarrass us for his own self-promotion.
Life Tabernacle Pastor Tony Spell is charged with 6 counts of disobeying government power.
Parishioners are going to his services. They're not practicing the 6-foot rule. They're not going by what the governor said or our President of the United States.
Central Police Chief Roger Corcoran is accusing Spell of making a spectacle out of his services.
He's doing exactly what he's doing this for publicity.
Corcoran unclear about whether or not Spell would be booked in jail.
I can't say that he's going to be booked in jail. It's not about booking him in jail. It's about the safety of our parish and our community.
We've reported on Pastor Spell's services a number of times. We even allowed him to tell our viewers why he did it. Since that time, local officials have been working with Spell, but the pastor reportedly wouldn't compromise.
It was time that it needed to be addressed, and it has been. So we're very grateful for that.
Despite the arrest, Spell services will continue.
I've talked to our district attorney, and I've advised him of the arrest, and it'll go far from there.
All right, Abby now joins us from Baton Rouge, Louisiana. Abby, law enforcement there saying that this pastor was out to embarrass and that they were worried about the safety of others. What can you tell us about this arrest? Did the pastor spend any time behind bars or did he make bail pretty quickly?
No, he did not. Due to what's going on here in Louisiana with COVID-19, a lot of law enforcement offices are not actually arresting people who are non-violent offenders. So he did not spend any time behind bars. He was actually issued summons and he gave his fingerprint, and that was the extent of his arrest.
Now, I'm looking right now at your Twitter page, and the pastor actually posted the ticket, the summons that he got. Tell me about what was in that, and did he post anything with that as far as why he posted this summons?
So that was actually posted by the Central City News.
Okay.
And on the summons, he was charged with 6 counts of disobeying government power during an emergency, I believe. Each of those 6 charges were for the 6 services he has held since our governor issued the stay-at-home order.
Has he said anything since his arrest? I know that in your story, they plan to continue doing these services.
Yes, and he did continue his services last night, and they were not shut down. Law enforcement did not respond in any way to the service, and it appeared there were hundreds of people still inside that church. Last night, he did give us some sound. He said that he's not changing his stance, and he doesn't really care that he was charged with this, and he believes that it is in our Constitution that he should be able to assemble freely.
What does he say about the safety of those who are going to the church?
You know, I've asked him that multiple times now, and he's compared it to going to a grocery store. He's saying that I will not shut my doors until every retail store is closed as well.
I got a lot more questions, Abby, but unfortunately, I don't have the time to ask them this morning. Interesting things. This is not the only pastor. A pastor, I believe, in Tampa also had situations like this. Abby, let us know what else happens. I'd be interested to maybe revisit with you after Sunday services to see if this continues. Interesting things happening. Abby, thank you so much out of Baton Rouge. Turning to Texas, more than 24 University of Texas students infected with COVID-19 after a spring break trip. We showed you all the pictures of people on spring break trips. Alyssa Gord explains why both local government officials and UT Austin are now actually investigating.
Austin Public Health explained this all happened around a week and a half ago when a group of 70 people in their 20s got on a chartered plane for a spring. They can't tell us whether these spring breakers are in Austin now.
Alyssa joins us. We're having a little conversation off camera. Alyssa, obviously a concerning situation. We have seen what spring break looked like in Florida on the beaches. Now we hear about UT students going to Cabo during everything that was happening. Time frame of this happened a week ago, week and a half ago?
The students took off in their plane about a week and a half ago. Now, we don't know exactly when they came back, but we do know that they came back at different times. Some came back on that chartered plane and others flew back commercial. So there's different paths that they could have taken and potentially interacted with other folks. But because the investigation is still ongoing with Austin Public Health, they're not telling us yet when each of these students or the individuals who are on the trip have gotten back to the U.S. or to Texas.
Alyssa, what's been the response on your station's Facebook page as far as the fear is concerned about these students leaving right in the midst of what was, March was a busy month, a stressful month for all Americans. What are people saying right now in the Austin area?
Well, in particular, there's a lot of students in the UT Austin community who've given us feedback on social media expressing frustration. Hey, I stayed home over spring break while these other people went off and traveled internationally and came back with a couple of cases of COVID-19, 28 in total, at least that we know of so far. And there has been a lot of criticism on social media, but the reality is the investigation has not been completed yet, and it's still a little unclear at which point each of these individuals contracted the virus, whether it was while they were traveling, whether it was while they were returning back, and where they could have traveled to since then. What we've heard is a lot of concern from people about whether they could have interacted with the folks who were on the trip. And the tricky thing is, while we do know that the 28 who tested positive for COVID-19 are UT Austin students, because classes at UT have all gone online right now, almost all of the students at the university are at their respective homes, which could be around the state of Texas, but it could also be around the world. And so it does not necessarily mean that these students came back to Austin. They could have gone back to their homes at any variety of different places. And so while there is a lot of concern in Austin, it's very likely that if these students traveled home, that the university is then communicating with local health departments to make sure that these students are aware of the other people who they could have come in contact with.
Yeah, obviously, Alyssa, we're talking about a very interesting thing. You mentioned investigation. There's not a legal parameter right now that these kids are going to face any kind of charges. Is the investigation more to figure out exactly where they went, who they talked to, try to get as many isolated as possible to protect any further community spreading?
Exactly. It is a public health investigation.
Yeah.
They're doing what's called contact tracing, which is basically figuring out who you've been in contact with, how you might have interacted with them, and who could have the potential to get infected if you're infected. And so this is a public health investigation to determine the scope of risk. In terms of disciplinary actions or anything, there's been no mention of that. And the reality is, when these students took off, or I should say, we've had no confirmation that all 70 who were on the chartered plane were students. We just know that the 28 confirmed cases are students. Whether these students actually, I'm so sorry, Aaron. What was your original question?
Well, my question was about the investigation, and I think you answered that one. The investigation, again, is not a legal one.
Yes.
All right, Alyssa, we're running out of time. Thank you. I appreciate you taking the time here on Newsfeed. Now, I do want to read the global health advisory as far as what we're talking about travel. Right now, according to travel.state.gov, it is a do not travel level 4 advisory right now. It advises U.S. citizens to avoid all international travel. Again, advises. So I want to mention that because these kiddos, these college students were traveling against this advisement, but it wasn't a mandate. Before we go on this April the 1st, let's end with a positive note. Take a look at the doctors and medical staff on your screen. They don't need a DNA test to know they're heroes. That's a line in a Lizzo song, because the pop sensation treated the University of Washington emergency room staff to lunch at a time when they were working long hours with equipment shortages because of coronavirus. So the Henry Ford Hospital in Detroit tweeted a thank you to Lizzo for providing lunch. If you don't know who Lizzo is, she was extremely hot last year. What's the name of the songs? Feeling Good as Hell, and what's the other one? Anybody? Matt is supposed to be my pop expert here, and nobody knows. Anybody? What's the other Lizzo song? Why can't I think of the other Lizzo song? I could sing Feeling Good, but I'm not going to. That's all the time we have on Newsfeed Now. Have a fantastic day. We've got another coronavirus update coming up at 3 p.m. Eastern, 2 p.m. Central. Have a good one, folks.